In 2003, I was finally diagnosed, I believe, with the right diagnosis. I'm diagnosed with being bipolar. They put me on the right medications, and I started stabilizing and doing very well. Part of my treatment went with medication, group therapy after I came out of the hospital. Well, even when I first came up here, as I mentioned, in 2000, I got hooked up with a partial daycare program. I'd be there from 9 to 3, and we learned, they had different groups there during the day, and we learned about different things. We would learn about grieving, about depression, and that was one. And then we'd have counseling. The other thing that's important is I go to a self-help center here in our town. I'm very active in it, and that helps too because you get out and you get in the social field. And they have groups there also. They have outings. That's very important that you get out. That helps me. Treatment-wise, is number one is your psychiatrist. They give you your meds. It's important that you follow up with them and you tell them whatever symptoms you're having from your medications. It's important that you take your medications as follows. Just because you're feeling better, that's not a sign that you can stop taking your medications. Talking, group therapy, individual therapy, those two are important. You have to get things off your chest, no matter how minor it may seem to you. A couple days later, it may get worse. But those are the things that I have found that works for me. It should work for you. Give it a try.